has been drained out. So this session is particularly, first of all, thank you so much for yesterday's session, where you helped me to recall almost the exact questions that were asked. So really thank you for yesterday's session. So this session is particularly for our new champs that will be targeting next year INICET. This is to help your juniors, like the way your seniors helped you out in the last year. We'll try to provide you the questions that came in this INICET May 25. Right, so hi, my name is Dr. Gourav, and I'm here to recall the pathology questions for you guys, which came in INICET. Hi I3. Hi I3, good to see you, bache. So INICET recall May 2025. My name is Dr. Gourav, and we'll try to replicate as many as questions which were asked in the same language, right? So we'll try to bring up with that. We'll start the session. First question: which of the following features are associated with granulosa cell tumor ovary, a type of sex cord stromal tumor? So you have to ask, you were supposed to tell the match of the following type, and all multiple choice questions were given. Hi Sandhya. Hi Sandhya. Which of the following is seen in granulosa cell tumor ovary? Col-external bodies? Yes. Inhibin positivity? Yes. Sex cord tumor origin? Yes. P120 deletion? No. It is seen in serous carcinomas. It is seen in epithelial carcinomas. So the best answer will be A, B, and C. I hope that was the exact question. Good evening, Amit. Good evening, Sandhya. Good evening, I3. Good to see you guys. So here the exact answer will be A, B, C. So just to revise you the exact questions for next year. So when we studied this in the class, we studied about granulosa cell tumor ovary with the mnemonic. If you were there in the yesterday's class, you remember granulosa cell tumor ovaries will be remembered by the mnemonic: inhibit calling your ex-girlfriend 99 times for coffee. Now she is your ex-girlfriend. There is no point calling her 99 times. She is busy drinking something else with her new boyfriend. There is no point calling your ex-girlfriend 99 times for coffee. So remember, when you think about granulosa cell tumor ovary, you'll think about inhibin positivity, which is a tumor marker. You think about col-ex, you think about col-external bodies. Col-external bodies, the bodies which have this pink eosinophilic lumen, we know that. So next year, be prepared for image-based question where have pink lumen, that is col-external bodies. Then you have girlfriend, means it is for granulosa cell tumor ovary. 99 means again ISC, it is CD99 positive. And you have coffee bean nuclei seen here. Coffee bean nuclei seen here. Can you tell me? Because we have to bring as many questions as for the next year. CD99 is also positive in Ewing sarcoma. Remember MIG2, we discussed this. Ewing sarcoma, you also call it as MIG2. And when you see coffee bean nuclei, can you guys tell me which other ovarian tumor has coffee bean nuclei, guys? Which other? Come on, waiting, Amit, Sandhya. Which other ovarian tumor you know which shows coffee bean nuclei? You need to answer this. You need to answer this. It has to be Brenner's tumor. Right, Brenner's tumors. So something special about Brenner's tumors, just remember, when you talk about Brenner's tumors, it has got the bladder-like epithelium, transitional epithelium. It has got a very special cell nest. Come on, answer this, Amit. You have Walther cell nest. And remember, here also you will have coffee. Very good, I3, very good. You will have coffee bean nuclei. Right? So this was the question where they asked about granulosa cell tumor ovary. And for next year, please remember. So these were the all probable question. Other, if you talk about sex cord stromal tumors, when I have to talk about other sex cord stromal tumors, remember, they can ask also about the main one is the Leydig cell tumor. This is again their favorite one, Leydig cell tumor. Can you help me with this? Leydig cell tumor, like granulosa cell tumor ovary, has this special collectional bodies. Leydig cell tumor, which is another sex chromosomal tumors, has another one more special microscopic feature. Can you tell me that? It is Ranke crystalloids. It is Ranke crystalloids, which is a Leydig cell tumor, again androgen producing tumor, so there is increased level of androgens. But then there is presence of Ranke crystalloids, which are very good I3, very good twinkle, which are again pink rod shaped inclusions. We all know Ranke crystalloids are again pink rod shaped inclusions. So call-external bodies, GCT ovary, Ranke crystalloids are seen in Leydig cell tumor ovary. Then, we'll move to the next question. Women present with bilateral multilobulated ovarian cyst. But this time, the cyst consists of solid components. Guys, solid means, write it down for me. Benign or malignant? When they say solid components, it is more in favor of malignancy. Then, her serum CA-125 was elevated. If I am not wrong, they wrote 900 in the level. 900 units per ml. 900 units per ml. Can you tell me what is the normal CA-125, guys? Normal CA-125 is 0 to 35 units per ml. And here they wrote 900. That means it is highly raised. So malignant because solid components, CA-125 because 900, that is highly raised. Which of the following is most likely diagnosis? No, 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 no. There is no doubt it has to be serous carcinomas. It has to be serous carcinomas. Carcinomas, so there will be solid component. CA-125 will be highly raised. And then you have 125 highly raised, rule out mucinous carcinoma. The gross was kind of tricky because they wrote multilobulated. I hope they also wrote omental caking. There were certain, so this INICET we discussed yesterday also. It was more of and dependent on art of excluding out. The questions seem to be easy, but options are very, very, very tricky. Gross examination might suggest patient has mucinous carcinoma because multilobulated, omental caking. There were words which might have forced you to go for mucinous cystadenoma, but no. Serum CA-125 900, such high CA-125. Yes, in mucinous there can be like slightly high CA-125, but 900 so much. The better answer would definitely be serous carcinomas. Right? Done. Let's move to the next question. Which of the following stain is not used for identification of aspergillus? Not used. I hope you would have picked the word not used or all except question. Then it was absolutely Congo red stain. Congo red stain we all know is for amyloid. It is not used to stain fungus. Rest other was okay, Himali. Thank you so much for this also. Okay, rest other than that, this is what we need to know, right? This is what happens in the real life. When you come to this real clinical practice, no, there are symptoms which might suggest you something else, but then we have pathology to confirm. We have radiology to suggest something. We have pathology to confirm everything, right? So this is where it goes, right? Congo red is myeloid. Rest is for fungus stain. And in this question, where students got trapped was this Mason-Fontana stain. Because we were taught that Mason-Fontana is used for melanin. But why is it used for fungal infection? Yes, it is used for fungal infection because there are certain fungi which contains melanin in their cell wall. So please be prepared for the next year. Fungi containing melanin in their cell wall. So there are fungi which contains melanin in their cell wall. So for that you need Mason-Fontana stain, and such fungi containing melanin in the cell wall are called as dematiaceous fungi. Did you study this in microbiology? Dematiaceous fungi. Remember, dematiaceous fungi are the fungi which contains melanin in their cell wall. For such dematiaceous fungi, we need Mason-Fontana strain. So yes, Mason-Fontana strain can be used for fungal infection. Rest also we all studied. Gomoremethamine is one of the favorite strain for fungal infection. Past strain we studied. It comes under silver strain. We studied this, and past anyway. Mayank, 146 correct. Very hopeful, brother. Very hopeful. And I'll say one thing, Mayank. Garg sahab, don't control the uncontrollables. Don't try to control that. You did your best shot. 146 correct. It's a good score, definitely. What we can do is at least attract the positive vibes. We all believe in manifestation. So as of now, I'm manifesting for you, Mayank Garg. You will get the general surgery with this number of questions correct. गलत बोल के नेगेटिव बोल के हो क्या जाएगा मेरे भाई? व्हाट इफ आई से नहीं मिलेगा तेरे को? Who am I to say this? और मिलेगा ही मिलेगा तेरे को. Who am I to say this? It is all energy around you. Believe in this third and this universal parts, right? You did your best shot. 146 correct. It's definitely a good score. Let's hope इतनी कट ऑफ आएगी, because definitely paper was a tricky one. So you can expect a good branch in this score, मेरे भाई. Right? Past and we all know it's not at all specific. Past is used for glycogen. Past is used for fungi. Pass is used for mucin. Pass is everywhere. तो pass से pass रहना है, दूर नहीं जाना है. Right? Done. So now, because aspergillus was asked in this question, and for next year, be prepared, boss. The difference on histology between aspergillus and mucormycosis. This is their favorite one again, to differentiate between aspergillus and mucormycosis. So how do you differentiate? Come on, I'm waiting for you guys. Amit, Himali, Twinkle, Himali, Mayank, मुझे बता दो, how do you differentiate between mucormycosis and aspergillus on histology? I told you, right? Absolutely, I'll do that, Himali. M for mucor, I'm for mota. A for aspergillus, A for apps. तो aspergillus के apps दिखते हैं. Apps दिखते हैं. Apps किसके दिखते हैं? जो मोटा होता है, जो परलीन होता है. So लीन होगा. Apps वाला लीन होगा. और लीन होगा तो इसके एप्स दिखेंगे. एप्स का मतलब यू हैव सेप्टेट. तो एस्परजिलस एप्स है तो लीन होगा, एंड विल बी सेप्टेट. वेयरएज मोटा है, अब मोटे आदमी के कब से एप्स दिखने लगे? इट विल बी एसेप्टेट. यस, यू हैव एंगल ब्रांचिंग, एक्यूट एंगल, ऑब्ट्यूस एंगल, बट सिंपल वे इज यू सी द थिक वन बाय मोटा आई मीन वेरी थिक सेप्टा. थिक, बट देयर इज एसेप्टेट. A for aspergillus, A for apps. Look at the first image. क्या बोलोगे? Which is the first one? इतना मोटा. Do you see any apps? You don't see any apps. So it has to be mucormycosis. 90 degree angle branching. मोटा without any apps. It is mucormycosis. But look at this patla wala. Can you see the six pack apps here? Yes. A for aspergillus, A for apps. A means septa. So when you see septate, it has to be aspergillus. So this year they have asked the fungal infection. Next year they can ask. This is what INICET do. They eat something, because in this year also I can definitely say 80% questions were PYTs only. PYT. So DAMS, DVT and all the LRR 80% were DVT only, were all PYQs only. Past year topics I mean. So aspergillus will again go down in next year as an important topic. Chalo, next question. A patient presented with multiple punched out lesions in the skulls. मुझे बता, looking at the clinical history, yes, you might have thought that he is thinking about multiple myeloma. But the next question, they all surprise you. Which of the following thyroid malignancy will do that? And this was image. This is punched out lesions. Punched out lesions. So Mir sir would have nicely discussed this. So this would go as which thyroid malignancy? Answer will be follicular carcinoma. We know this. There was very important topic that we discussed. We discussed the difference between the papillary and the follicular. Papillary and follicular. I told you papillary cancer will have history of radiation. Last year they gave history wise radiation. Follicular will give you history of long standing goiter or iodine deficiency. Gene, if they ask you, there is a gene, that is BRAF gene. Most commonly, papillary carcinoma occurs because of BRAF gene, not mutation. If you remember, it is because of translocation. Whereas follicular will go because of KRAS gene mutation. KRAS gene mutation. And about the other questions, remember the spread is different. Papillary cancer has a lymphatic spread. As lymphatic, whereas we discussed follicular has hematogenous spread. Can you recall and tell me which lymph nodes are commonly involved? We discussed cervical. So we discussed P for papillary, P for patient will come post radiation. This is we discussed in the class. P will come for post radiation and with palpable cervical lymph nodes. Palpable cervical lymph nodes, whereas hematogenous spread will give you lungs, liver, distant metastasis and bone also. Hematogenous will go to bones because they are asked about bone. Remember, it has to be follicular carcinoma. Not to get confused for next year between medullary carcinoma, thyroid. Come on guys, medullary carcinoma, thyroid, which gene? This is again RET gene mutation. This is time it has again RET gene mutation. Remember, if medullary carcinoma also shows hematogenous spread and it also will metastasize to bone. So thankfully there was no medullary carcinoma thyroid to pick one. It medullary carcinoma also shows hematogenous spread and will metastasize to bone. Another thing about medullary carcinoma thyroid that you definitely need to know, it is a neuroendocrine tumor. So it will be positive for synaptophysin and chromogranin. Synaptophysin and chromogranin. Right, and for histology wise we all know it is amyloid positive. Medullary carcinoma thyroid is amyloid positive, right? Yes, tumor marker we all know calcitonin, a cal type of amyloid, calcitonin positive, a cal type of amyloid is seen. Done. Next question, which of the following is not aneuploidy? It is not aneuploidy. Simple MCQ. Answer is Bloom syndrome. We discussed this. This is an example of DNA mismatch repair syndrome. Recombinant DNA mismatch syndrome. Mismatch repair syndrome. We discussed this. Recombinant DNA mismatch syndrome occurs because of helicase gene mutation. I told you this enzyme or recombinant DNA mismatch repair genes generally protects you from radiation. We all know whenever there is radiation exposure, radiation cause breaks in the double-stranded DNA. And this is repaired by recombinant DNA mismatch repair genes involving helicase. And if there is DNA mismatch recombinant DNA repair syndromes, example we all know we discussed in the class with the important three main one, that is AFB. Hi Tejesh. A for ataxia telangiectasia. F for Fanconi anemia, and B for direct question from back to basics. They ask you, we discuss AFB mnemonic, Bloom syndrome is DNA repair syndrome, and we also discussed this. And in all these recombinant DNA repair syndrome, there is certain common things. All of them will come to you with structural deformities. Right, Fanconi doesn't have thumb, absence of thumb, Fanconi anemia. And all of them are sensitive to radiation. Because these genes protect you from radiation, all of them are sensitive to radiation. So on exposure to radiation, they can develop leukemias. Right? So here, Bloom syndrome comes into category of DNA repair syndrome. And next question. Which of the following cancer is not associated with obesity? Not associated. I really hope all of you would have picked not here. And the answer is multiple myeloma. Absolutely no history of multiple myeloma, with no relation with association of absolutely radial Redika. Thank you so much. Multiple myeloma, it is more of a genetic disorder where the most common genetic involvement seen is hyperdiploidy. Multiple myeloma, the most common reason is hyperdiploidy. It has absolute no relation or association with obesity whatsoever. Rest all can have. Meningioma can be tricky. Meningioma, yes, I have discussed this. Meningioma is commonly seen in males or females. Females, obese females are prone to develop meningioma. You see, questions seem to be very easy. Obesity causes which cancer? But then questions, options were tricky. This is INICET for you. Questions seem very easy. Which cancer is caused by obesity? But then there were tricky cancers. So can you tell me, everybody, if they next year they ask you, obesity is most commonly linked with which cancer? Most commonly, everybody, obesity is most commonly linked with which cancer? Anybody? Linked with, remember, linked with E cancers. Linked with E cancers. By E, I mean most commonly obesity is linked with this E cancer, endometrial and esophagus. Endometrial and esophagus. Absolutely, Ridhika, options ही confusing थे यार. This is why I'm not saying कि paper easy था at all. I'm not saying this. It was tricky question. It is very easy to sit on YouTube and comment, "Arey easy tha, everything was from the notes." It was not really. Yes, questions were PYTs, but there, yes, the mental balance, the mental equilibrium was required to read the question from A to Z and to rule out the abnormal stuffs, right? So endometrial and esophagus are the two most important cancers linked with obesity. But other cancers caused by obesities are, we have to list the other cancer linked with obesities are, yes, postmenopausal breast cancers, absolutely. Postmenopausal breast cancers, colorectal, endometrial to we discussed, renal cancer and liver cancers. Right? These are the common link cancer, but remember E. Nahi tha Himali, don't go with the moderate paper. See, I'm telling you, I was not the student out there. I was not there for that long time the way you were there. मेरे लिए बहुत आसान है यहाँ से बोलना कि पेपर इजी था, मॉडरेट था. Don't take it another way. When I say moderate या anybody says moderate, इसका मतलब what we are trying to convey is क्वेश्चन नोट से बाहर नहीं था. यस, टाइम कॉन्स्टेंट था. हमारे लिए यहाँ पे 4 लाइनें पढ़ के डिसाइड करना बड़ा आसान है. आप लोग वहां पे थे, आप लोगों को 7 लाइनें पढ़नी थी. यू हैड टू रीड द 7 लाइन्स, पिक द इंपॉर्टेंट लाइन एंड देन गो फॉर द क्वेश्चन. इट इज नॉट ईजी, ट्रस्ट मी, इट इज नॉट ईजी. तो जो आपने कर दिया, इट वॉज डेफिनेटली द बेस्ट शॉट. बस नाउ लीव ऑन गॉड. इफ यू आर डन द हार्ड वर्क सिंसियरली, ही इज देयर टू हेल्प यू आउट. ही इज देयर टू हेल्प यू आउट, right? Then, but remember, E cancers are most commonly linked with cancers. Now, most common inherited bleeding disorder. Most common inherited bleeding disorders. वहां पे एग्जाम में इतनी छोटी लाइनें नहीं आती ना. एग्जाम में इट इज सच अ बिग लाइन एंड दिस सच अ स्ट्रेसफुल एटमॉस्फेयर. Time limit is there. Such a stressful atmosphere. It is not easy to read the question, right? So it is definitely von Willebrand disease. Von Willebrand disease is the most common linked, most common inherited. Direct question from back to basics. Same line we studied. Most common inherited bleeding disorder is von Willebrand disease. इसकी कमी है von Willebrand factor की. क्या काम है? 2 काम है. One is platelet adhesion and other is increase the lifespan of factor number 8. But this was so direct MCQ. I'm sure ये तो आप सबने ठीक किया होगा. Direct question back to basics. Thank you बच्चों, thank you बच्चों. It's all because of you guys, right? So platelet adhesion है, so then obviously bleeding time will increase, lifespan कम हो जाएगी, तो APTT will be increase. We discuss straight away this question from back to basics कि BT भी बड़ा हो, APTT भी बड़ा हो. Think about von Willebrand disease. Types की अगर मैं बात कर लूँ, if you remember von Willebrand disease, 2 types we studied. Quantitative defect हो सकता है for von Willebrand factor and qualitative हो सकता है. Quantity defect is seen in type 1 and type 3. Type 1, type 3 is quantitative defects. Type 2 is qualitative defect. Remember, in type 1 there is mild deficiency. In type 3 there is severe deficiency of von Willebrand factor. Treatment भी बता दो मुझे. Intranasal you give desmopressin. You give desmopressin to induce Weber pallidary bodies to make more Willebrand factors, and also not, you can give cryoprecipitate. We know this. Cryoprecipitate has factor number 8 and von Willebrand factors. Right, so this was a straightforward question. Let's move to the third question. Caspase 1, again an easy one. Ye to I'm sure everybody would done right. Caspase 1 is involved in pyroptosis. So I won't take much time, but just quickly revise the caspases. Just quickly revise the caspases. First we'll talk about apoptosis की बात करते हैं. तो apoptosis में 3 क्वेश्चन बन गए. Intrinsic pathway के caspases, extrinsic pathway के, and execution stage के. ये तो all of we know this. Intrinsic pathway में we all know caspase number 9. EX से extrinsic caspase number 8 and 10. Execution में आ गया 3, 6 and 7. We all know this. 3, 6 and 7. सर pyroptosis की बात करें, it is primarily 1 and 11, but remember caspase 1, 4, 7, 11. Main is 1 and 11. But there are 3. INICET can ask all except question. Main is caspase 1, caspase 11. Necroptosis में there is no caspases. This also we have discussed. Direct question from back to basics. It is caspase independent. Caspase independent pathway. Right? Next question. Erythropoietin is used. Again, match the following question. Useful in treatment of which of the following type of anemia? Erythropoietin. I think it was a straightforward question. I don't think you would have made it wrong. It is B, and they ask you a multiple choice question. Only B was the answer. So here the question will be only B. No nutritional anemias. Nutritional anemias you treat by the type of nutritional coming. Iron की कमी है, so you give iron therapy. B12 की कमी है, you give B12, folic acid. There is no role of erythropoietin in nutritional anemias. Myelofibrotic and bone marrow transplant you have to do. When there is fibrosis, we all know fibrosis is irreversible. To go with bone marrow transplant, again aplastic anemias, you give colony forming units. There is no role of erythropoietin here, because anyways there is no stem cells. Because there is no stem cells, what is the point of giving erythropoietin? There is no stem cells. Obviously, we all know erythropoietin can only stimulate stem cells to make RBC. There is no stem cells, so aplastic anemia. I hope you would not have gone for aplastic anemia. There is no stem cells, so there is no point of giving erythropoietin here. So here only B would be the answers. Right? I hope there is no confusion. Now, which of the following is false regarding gene cancer association? Gene cancer association. Dr. Narayana, this is really special. Dr. Narayana, thank you special. Yeah. Wish you हो now doing MS Orthopedics. Thank you, Vellore Medical College. God bless you, मेरे भाई. God bless you, buddy. STK11 really means a lot, Baba. STK11 gene mutation, carcinoma breast, yes. BRCA2 prostate cancer, yes. We studied this. And TP53 mucosal neuroma, no. I hope there was no match of the following question. P10 is for thyroid lesions, right? So quickly revise. First of all, when you talk about STK11, remember STK11 generally is involved in STK gene. STK11, when you study, it has to be stomach. T for testicular cancers and K for colon cancers. K for colon cancers. STK31 is stomach, testicular, colon cancer. And then we all know STK11 PJ syndrome. I hope you remember PJ syndrome, Peutz-Jeghers syndrome. It is also linked with Peutz-Jeghers syndrome. And PJ syndrome patients are prone to develop pancreatic cancer. So it can also cause pancreatic cancer. So STK11 gene can cause stomach, testicular, colon and pancreatic cancer, causing Peutz-Jeghers syndrome. Talking about BRCA2, we all know this. We have studied this. Direct question from my notes for all of you listening now. I discussed this when I was teaching you BRCA2. I told you with a simple mnemonic. 2 means both. Both. Remember both. So it will cause both male and female breast cancer. Male and female breast cancer. 2 means both. And also we discussed when I said both, in males it will cause breast plus prostate cancers. So 2 things I told you in the class. I hope all of you made it right answer. For next year, remember both means this BRCA2 will cause breast cancer in both male and female, and in males also both. It can cause breast plus prostate cancers. Great question from the notes. I hope there is no doubt about this. P10 to we know. P10 there was this thing. P10 gene is for Cowden syndrome. Please tell me the mnemonic that we discussed in the class. Come on my students, come on. P10. I told you P10 has got 10. So 10 rupees bet on cow. I hope you remember 10 rupees bet on cow. That is Cowden syndrome, P10 gene mutation. So B for breast, E for endometrial, and T for thyroid. T for thyroid. So straight question, thyroid, yes, it causes thyroid cancer. So only thing is left is mucosal neuroma. Mucosal neuroma is a part of men to be, which is associated with RET gene mutation. RET gene mutation. So mucosal neuromas is not a part of T53 gene mutation. It is a part of men to be. This occurs because of RET gene mutation. Right? Done. TP53 we all know. TP53 will lead to Lee-Fromani syndrome. Lee-Fromani syndrome, where there is no association with the mucosal neuromas. Right? Done. Next question, straightforward question. Which of the following HPV are associated with cervical carcinomas? I don't think that was at all difficult. It is 16, 18. Remember 6 and 11 is cause benign lesions. It cause condyloma acuminata. It cause warts. It cause condyloma acuminata. It cause benign squamous papillomas, but it does not cause cervical cancers. So for next year, remember, warts and benign squamous papillomas is a part of HPV 611, whereas 16-18 cause adenocarcinoma. 2 things they will keep on asking about HPV virus. Come on, quickly revise. It has got E6 gene. E6 inhibit. Come on, quickly tell me guys. E6 inhibit. P53 gene. E7. 7 is Dhoni. Dhoni is rub. The god, the real modern day rub of cricket. E7 RB gene mutation. And the third protein that HP1 has, L1 capsid. I hope you remember. L1 capsid is for vaccine production. Is for the vaccine production. Right? Done. And can you tell me one special microscopic cell seen in this patient? You have coilocytes. Coilocytes are seen in this patient. What do you mean by coilocytes? They have perinuclear halos, racenoid nuclei. So perinuclear halos are seen in this patient. So coilocytes seen in HPV virus, right? So they will keep on asking this question. HPV is always the favorite one. So keep studying about HPV. Next question. 24-year-old woman with breast lump. Biopsy reveals her mother died of breast cancers at 31, and they wrote only because of financial constraints, only one test was possible. They wrote this line, because of financial constraint, only one test was possible. And they give a microscopic image, and if I'm not wrong, mammographic image was also given. Mammography showed calcification that I'm sure Sumer sir would have discussed. From my pathology, they gave this image. If I'm not wrong, kindly correct me if I'm wrong. They gave an image of comedonecrosis, this central pink necrosis. Central pink necrosis, that is comedonecrosis. Was this image given, guys? I came to there was a microscopic, there was a mammographic image and a HP image, and this most probably would have been HP image. Central peak necrosis done directly seen in DCIS, ductal carcinoma in situ, and ductal carcinoma in situ is commonly seen in the patient of BRCA1 gene. Even though there was no correlation with the history, the gene and the single gene that you will go for breast cancer is BRCA1 gene. We discussed about Angelina Jolie in the class also. BRCA1 gene is the most common inherited gene associated with breast cancers. Most common inherited gene with breast cancers. Remember, acquired is TP53 gene. So if you have to go for, because of financial constraint, one test, BRCA1 would be the best answers. Remember, TP53 is the most common acquired gene involved in breast cancers. T10 we just studied, yes, it can cause breast cancers, but that will be associated with breast Cowden syndrome. Anybody quickly tell me, CDH1 gene, which breast cancer? CDH1 gene, which breast cancers? Lobular breast cancers. CDH1 gene is associated with lobular breast cancers. Right? Single test, because of financial constraint, go with BRCA1 gene. If they write about other with thyroid and endometrial debt lesions, go with PTN gene. If they write lobular breast cancer, how will you come to lobular breast carcinoma? I hope you remember the SBI feature we discussed. Come on, tell me the lobular breast carcinoma SBI feature. S for which cells you will have? Signet ring nuclei you will have. B for the patient will come to you with bilateral breast mass. I for you will have Indian file pattern. Last year they asked lobular breast cancers. This year they asked about the gene. So what genes are always important. So next, remember for next year genes, other genes involved in breast cancer. Remember CHEK2 gene. Anybody remember from my class? CHEK2 gene is associated with breast cancer, associated with radiation. I told you in the class, before taking radiation, nicely check it. Check, otherwise you will develop breast cancers. And next, PALB2 gene mutation. This was last year INICET. For my upcoming students, remember PALB2 gene is, it is because of single allele or bilateral allele. Single allele will cause breast cancers, but bilateral allele loss of PALB2 gene is linked with Fanconi anemias if there is biallelic loss. If there is uniallele, single allele loss will cause breast cancers. Single allele loss will cause breast cancer or pancreatic cancers. But biallelic loss, straight question from the notes, it was breast cancer. So breast cancer genes are very important. Make sure you're thorough with this, right? Done guys, done. Next question. Which of the following immunodeficiency disorders is HLA mismatched transplant rejection test least likely? So there cannot be HLA mismatched transplant rejection. Least likely. I really hope you would have read this word. Least likely. And the answer would be Bayer lymphocytic syndrome. Straight question. Check back to basics. We have studied this. In Bayer lymphocytic syndrome, you call it BLS. There is deficiency of MHC molecule. If there is no HLA molecule, how can, we all know, in humans we call it MSC. If there is no, in animals we call it MSC, in humans we call it HLA. If there is no MSC molecule, how can HLA mismatch reactions occur? So that is not possible. I know, for me it seems a very easy question. It might not have been for you guys, because there was a catch here. HLA mismatch will occur when there is no HLA molecule present. The deficiency of MSC molecules is linked with, deficiency of MSC molecules leads to Bayer lymphocytic syndrome. And I told you, there can be deficiency of MSC type 1 and there can be deficiency of MSC type 2. Type 1 means it is Bayer lymphocytic syndrome type 1. So there will be no recognition by CD8 cells. And deficiency of MSC2 will lead to Bayer lymphocytic syndrome type 2. So if there is no MSC molecules, no HLA molecules, HLA mismatch reactions cannot occur. So that would be the best answer. But remember, we discussed yesterday also, In SCID also, there cannot be HLA mismatch reactions. No HLA mismatch reactions. Reason, again, there is no lymphocyte to react against this even though there is recognition by FMGE molecules, because there is no CD4 CD8 lymphocytes, there cannot be mismatch reactions, because in SCID we all know there is no B and T lymphocytes which can function. For next year, if there is no Bayer lymphocyte syndrome, there can be SCID, right? Let's discover other options also. Other options, Wiskott-Eldridge. Come on, guys. Wiskott-Eldridge, if I have to talk about, I hope you remember in Wiskott-Eldridge syndrome. Can you recall the mnemonic, guys? People who studied from me. I told you Wiskott-Eldridge has got rich. And I told you in the class, rich people wear small tie. Eldridge syndrome. Rich people wear small tie. Rich people wear small tie. So that was the mnemonic to remember Wiskott-Eldridge syndrome. Small for, you remember, the patient has very small platelets. T for, they will have thrombocytopenia. I for, there will be infections because of immunodeficiency. And E for, there is eczema because there is increased IgE. There is increased IgE, so allergic reactions are seen. This is about Wiskott-Eldridge syndrome. Rich people wear small tie. And then there was one more syndrome that they asked us, Job syndrome. Anybody, what is Job syndrome? In Wiskott-Eldridge syndrome, Ig level increases. What about Job syndrome? Anybody, Job? Yes, it is absolutely X-linked recessive है, WASP gene की mutation से है. Not talking about Job syndrome. Anybody? You told me the gene, WASP gene. So come on, Job syndrome, STAT3 gene mutation. It occurs because of STAT3 gene mutation. And if you remember Job syndrome, I told you Job syndrome, it is also known as hyper IgE syndrome. Hyperimmunoglobulin E syndrome. There is increased level of IgE. So Wiskott-Eldridge syndrome, Ig level increase. Job syndrome also Ig level increases. Then what are the clinical features? Remember Job, I told you, सारा job पे वो नहीं जाएगा, so सारा दिन जो LCD के आगे बैठा रहेगा. Straight norm question from back to basics. Hyper Job syndrome, LCD clinical feature occurs. L for, they will have lung infections. Lung infections means pneumonia. C for, they will have two things, cold abscess and coarse fasciae. D for, they will have cold abscess and they will have coarse fasciae. So there is abnormal fasciae also. And D for, they will have dermatitis or eczema. So clinical features are similar to Wiskott-Eldridge syndrome. There is dermatitis, there is eczema, there is IgE level. So cold abscess, coarse fascia will help, and gene level will help. Yes, again they can have tooth retention also. Yes, Ritika, they can have tooth retention also. Job syndrome. And how many eosinophils are required to call it Job syndrome? There is more than 2000 international units per ml. Ig is more than 2000 IU per ml to call it Job syndrome. Right? So small people, rich people wear small tie. Job पे वो नहीं जाते जो सारा दिन LCD पे बैठे रहेंगे. Right? The next question again might seem very easy to me, not for you guys for sure. There was a tricky, which you are following is not characteristic glomerular finding, guys. Glomerular finding. Podocytes lost? Yes. Finding? Yes. Thinking? Yes. Armani abstrals cannot be a glomerular finding. We discussed this in the class. One need INICET predictor. We discussed about Kimmel-Wilson disease. I told you the first finding is basement membrane thickening. Then the second finding is there is nodular glomerulosclerosis, which is popularly known as Kimmel-Wilson disease. And then you have finally nodular glomerulosclerosis occurs because of mesangial widening. Straight question from the notes. Mesangial widening. And finally, there is diffuse glomerulosclerosis. Diffuse glomerulosclerosis. Anindita, we discussed this. There are 3 microscopic lesions. So whenever glucose end products increase, first of all, glucose deposits in the basement membrane. So because glucose molecules deposit in basement membrane will get thickened. Next, this glucose, if keep on increasing, deposits in mesengium. Because when glucose deposits in mesengium, it leads to sclerosis. And you have a special type of necrosis, that is nodular glomerulosclerosis, popularly known as Kimmel-Steele-Wilson disease. And if still patient keep on eating glucose, the glucose will finally damage the entire glomerulus. More than 50% glomeruli will be involved. That is called as diffuse glomerulosclerosis. So there are 3 histological lesions: increased base membrane thickening, nodular glomerulosclerosis, diffuse glomerulosclerosis. Armani abscin cells is not a glomerular finding. Straight question from the notes. People have studied from me. I've told you these are PCT cells. It's not a glomerular finding. It is tubular finding. PCT cells which is laden with glycogen. That is called as Armani abscess. Yes, it is seen in diabetic nephropathy, but you would have read the question. Check my notes, check my workbook. Clearly written. It is PCT cell, so it's a tubular cell, not a glomerular finding. Armani abscess cell, diabetic nephropathy, but it's a tubular finding, and they asked the glomerular finding. There are 3 glomerular findings as discussed here. Hello. Next question. Child present with petechia, purpura, platelet count of 10,000. Bone marrow shows increased megakaryocytes. Treatment given. There is purpura, there is a child, and there is a increased megakaryocytes. Goes in the favor of acute ITP. But then when you talk about acute ITP, what is the initial treatment given? That was the exact line, if I am not wrong. Yes, you told me. What is the initial treatment given to the patients? If you remember, we studied this. In acute ITP, the best treatment is to wait and watch. Generally, because this is not in the option. So rule out this option. Next, we discuss this. Initial treatment is you start with steroids. Then you go to IV immunoglobulins. And we have discussed this only in refractive cases. Only in refractive cases you go for splenectomy. So now initial treatment, 3 possibilities. Wait and watch given? No. Steroids given? No. So better answer becomes IV immunoglobulins. I told in the class, this IVIGs target the IgGs which cause damage to the platelets. They target the IgG antibodies. This recombinant immunoglobulins target the IgG in the patient's body, and these IgGs are one which are the culprit. These IgGs are the one which cause damage to the platelets. So these are the IV IgGs given to the patient. So out of this, because wait and watch is not in the option, steroid is not in the option, IVIG becomes the best answer. Aspirin is anyway not given, and they remember not done. So next year they can ask, what is not done in ITP? You don't give platelet transfusion. So for next year we are ready. You don't give platelet transfusion. You don't give aspirin in this patient. Why will you give antiplatelet? And giving platelet transfusion will cause more damage, will inhibit the compensation by the bone marrow. We straight away discuss this question, right? So what we do is, we did wait and watch. We give steroids, we give IgGs, and we do in refractive cases splenectomy. Right? Next question. Mechanism of cancer cells consuming more glucose. So cancer cells consuming more glucose, you must study this in biochemistry also. This is Warburg effect. And we know, again, a tricky question. At first point, increased glucose transporter would have been a better answer, but he told me there was oxidative phosphorylation also. And remember, there is no role of oxidative phosphorylation. We have studied this. Warburg effect is called as aerobic glycolysis. Aerobic glycolysis. So best answer becomes as lactic acid preferred despite oxygen, because we all know that generally lactic acid is preferred in anaerobic conditions, but in cancer cells, in spite of, I hope you remember what is Warburg effect. We have studied this. Warburg effect means in presence of ample oxygen also, cancer cells prefer glycolysis. Generally in presence of oxygen, a normal cell. So whenever oxygen is present, a normal cell will prefer oxidative phosphorylation. will prefer oxidative phosphorylation, but cancer cell in presence of oxygen, cancer cell will prefer aerobic glycolysis only. So lactic acid preferred despite oxygen, aerobic glycolysis only, where a pyruvate is converted into lactic acid. So this is glucose hunger. So here the best answer is lactic acid preferred. Remember, there is no role of TCA or there is no role of oxidative phosphorylation in the Warburg effect or in the cancer cells. They prefer aerobic glycolysis because there are intermediate products formed. There is an HMP pathway where there is so much nucleotide synthesis. This is what cancer cell prefer, right? For next question here, remember, there is normally, what is the mechanism? There is increased GLUT2 receptor. PI3 AKT pathway is used. What are the other questions that they can ask from next year from Warburg effect? PI3 AKT pathway, we have discussed this, everything back to basics. And the gene involved in Warburg effect is MYC gene. Involvement of MYC gene. This is all about Warburg effect for next year, for your juniors. Youth will definitely clear this year, I'm sure. This is for your juniors, right? GLUT2 receptors, PI3 AKT pathway is involved, and MYC gene is involved in Warburg effect. Done. Now, which of the following is incorrect about free radical? Incorrect about free radicals. Lipid peroxidation, yes. The multiple choice question came. Lipid peroxidation, yes. Produced by neutrophils and involved in respiratory burst, yes. Superoxide dismutase inhibit free radicals, yes. Fibroid necrosis, nothing man, nothing man. So answer will be A, B and C. We have studied about free radicals, about the reactive oxygen species. We all know free radicals are reactive oxygen species, and we all know this. Reactive oxygen species cause damage to lipid, called peroxidation of lipid. This is why lipofuscin is prepared. Lipofuscin is produced. I hope you remember from the class. Lipofuscin is also known as telltale sign of free radical injury. Straight question from the notes. Telltale sign of free radical injury. So because the lipids, because free radicals damage the lipids, they cause peroxidation of lipids. Because of peroxidation of lipids, lipofuscin is produced. So lipofuscin presence is a sign of free radical injury. Straight question. Produced by neutrophils and animal respiratory burst. Absolutely, there is in respiratory burst, there is release of free radicals, and which cause damage to the bacteria. Superoxide dismutase absolutely inhibit free radicals. We studied there are three enzymes, anti-enzymatic enzymes we studied. I hope you remember this from back to basics. What was the mnemonic, guys? Anti-enzymatic enzyme, enzymatic antioxidants. Antioxidants. There were three enzymatic antioxidant, and we studied enzymatic antioxidant with the mnemonic GCS. Come on, G for glutathione peroxidase. Glutathione peroxidase. C for catalase, and S for superoxide dismutase. Direct question. Correct पूछा था, तो correct is C, obviously. Notorious, I think it was right. A, B, C will be correct answers. And this was our GCS, Glasgow Coma Scale. This was mnemonic. And superoxide dismutation. Come on, tell. Mutation lead to which disease? Amyotrophic lateral sclerosis. This also we discussed. Superoxide dismutase loss will lead to amyotrophic lateral sclerosis. Next question, you studied pediatrics. In 5 minutes your pediatric class will start. Which of the following is not observed in Turners? I hope you remember, not observed in Turners. It was this the exact questions? Prominent occiput. Prominent occiput is not seen in Turner syndrome. Prominent occiput. Remember, I told you in the class, go and check the notes. I told you the mnemonic also. Extra occiput is for E for extra, E for Edwards syndrome. So extra occiput is a feature of Edwards syndrome. It is not the feature of Turner syndrome. And if you remember Turner syndrome, I told you the mnemonic of Turner syndrome is there is a clown. There's a clown sitting on short horse. A clown is sitting on the short horse. C for cardiac deformity, which is normally coarctation of aorta. coarctation of aorta, and there is bicuspid aortic valves. Bicuspid aortic valve. L will tell you the patient will have lymphedema. I hope you remember lymphedema. Cystic hygroma we discussed in the class. O4 there will be ovaries which will be not developed. We call it streak ovaries. Streak ovaries are seen in the patient of Turner syndrome. W4, this patient will have webbed neck. N for the nipples will be widely spaced. Short for they will have short stature. And horse for they will have horseshoe kidney. Right, done. I think the total number of question was 19. Horseshoe kidney. So clown on short hair for Turner syndrome. E for prominent occiput. E for extraput Edwards syndrome. Last question. This was the exact question. If you can recall, please help me out. Alleles of genes pool belongs to. Alleles of genes pools belong to. Was this the short question? If you can recall the exact statement would be really helpful for me. The answer was population. What is this? Remember, genetic gene pool means, what do you mean by genes pool? Gene pool means complete set of genetic information. There is a complete set of genetic information that is called as alleles on all individuals of populations. Great. So straight question. I really thank you so much. So what is gene pooling? Gene pooling is the study of alleles of all the individuals of population. So population asked. So that was the best answer. So 19 question. Before going, I have a doubtful. There was one more question. If there is there, please comment on granulomatous vasculitis. Was this question given? Causative agent of granulomatous mastitis. Was this question asked in the exam? Kindly help me out with this. And was the options there is Corynebacterium, granulomatous mastitis, Corynebacterium. Was there a causative agent of granulomatous mastitis asked in the exam? Yes, great. So I can say there were 20 questions from pathology, which is definitely a good score. So that is all from my guys' side. Thank you guys. Dr. Siddharth is waiting for you for PDF session. That is all. I'm really hopeful that all the hard work that you as student and we as faculty have put in, I mean by all the DAMS faculty, will definitely give us good results. So that is all. Yes, Corynebacterium is the causative agent for this thing. Thank you so much, guys. God bless you. That is all from my side. Now, people who have given this. Okay, so there was 2 options given. Okay. So there was 2 options given. Then the best answer is Corynebacterium. So then best answer is propensity. This was the best answer for Corynebacterium granulomatous mastitis, right? So propensity is the best one which causes granulomatous mastitis. So that is all, guys. Thank you so much. Siddharth sir is waiting. That is all. Please, people who have given is no negative thinking. No negative thinking at all. No negative thinking at all. Right? You have your work is done. Have a good sleep. I'm manifesting for all of you. You will also have to manifest positive thing for you. We will definitely get a branch that we really look for. Otherwise, we don't know what we have to do, right? That is all, guys. Thank you so much. God bless you. Bye.